got a swelling on my finger and I need to have it looked at. So I thought best place to come to see the doctor first. So came in to make an appointment.
From a patient's point of view, the community pharmacy service will mean that a patient will come to the desk, and we've set up some safe protocols, which means that there are certain, probably slightly more minor conditions, we feel it's okay to signpost to the community pharmacies, and a patient advisor or previously known as a receptionist would then transfer you over and suggest that you went to see a pharmacist. So I think one of the things that patients shouldn't be feeling is they shouldn't be feeling fobbed off by this. This is appropriate care being given by appropriate clinicians, in this case a pharmacist, and I think that works twofold. Actually, they're probably going to be seen more quickly by a pharmacist than they probably will be by a GP or a nurse practitioner within the surgery. And secondly, it means that we as GPs and nurse practitioners within the surgery can be focusing in on those patients who really do need our time and have more complex health needs.
Spoke to the receptionist, who was very helpful, and said I didn't really need to see the doctor. I'd be better going to the pharmacy, which is just next door. They can deal with minor ailments there.
What happens when a GP makes a referral? We'll obviously open the referral, have a look at the referral, and then see what the patient needs. We'll then bring the patient in the consultation room and then go through the referral and see if there's anything over the counter that we can sell them. We've got sore throats, eye conditions, ear conditions, dry skin, eczema, pediatrics, it could be foot care, anything. If there's something that we could sell to the patient, through the referral scheme, we can always sell it to them. The benefit to the patient is they will get treated straight away. They can start the treatment quickly rather than having to wait for an appointment or go back to see their GP. They're seen in the pharmacy as soon as the patient walks in, really. If we can't deal with the patient and the need referring back to the doctor, we would contact the surgery because we have a referral number or a telephone number in which to sort of refer the patient back to the GP, identify what the problems are, and the patient would then be seen via the surgery.
One of the good things is we have good links with them, so if a pharmacist feels that it's outside their area of expertise, or they feel that it does need a different clinician, they will refer back to ourselves, so patients should feel safe that this is a safe service, that they'll be looked after.
Pharmacists are highly trained professionals who spent years studying, and they know the best course of treatment for the patient, and we would strive to meet the needs of the patient.
The pharmacist had a look at it, and she knew what it was and suggested I need some ointment to put on it, and try that for about a week, and if I have any further problem with it, to come back. But no, I thought it was a really good service there to be able to go straight away rather than waiting for an appointment with the GP. It's a minor thing, and I can get it looked at straight away and see what's wrong and what can be done about it to make it better.